Welcome to the August issue of PRS. This month is replete with great content. We know your time is precious. So this month I'm going to highlight 5 important articles that I think you'll find both fascinating and even potentially practice-changing. So start your timer. This is PRS in 4 minutes or less. When faced with radiation therapy after a mastectomy, 2 strategies are often employed: delayed immediate autologous breast reconstruction or delaying autologous breast reconstruction alone. Read this important study which compares perioperative complications and revision rates to find out which therapy provides better results for our patients. In order to improve and standardize the success of fat grafting, this next author team compares harvest methods head-to-head: suction-assisted lipectomy versus ultrasound-assisted lipectomy. They also compared fat processing techniques, centrifugation, cotton swab rolling, as well as filtration. What results can we transfer from the lab to the operating room based upon these results? Check out this important article and you'll see that it may change your fat harvesting techniques and processing techniques as well. In this next article, we see that many plastic surgeons have been exploring ways to help patients with facial and upper extremities injuries by performing simultaneous vascularized composite allotransplantation procedures on the bilateral hand and face. Because this procedure remains so highly controversial, this multinational team of authors have teamed up to present their experiences for this very challenging procedure. By dispelling misconceptions, learning experimental lessons, and teaching us, they hope to keep pushing plastic surgery forward. For the past 30 years, there has been a growing library of data questioning the use of clinical subcutaneous drains. The critics continue to amass, saying that closed suction drains carry greater risk, cause great discomfort and anxiety, and decrease mobility as well as morale and independence. Yet, plastic surgeons continue to use them because of the presumed benefits like preventing hematomas and seromas. To settle this debate, the authors of this paper performed one of the largest meta-analyses of randomized controlled clinical trials ever. Is there a difference between subcutaneous, prophylactic, closed suction drainage of the wound and no drainage at all? Read this interesting article to discover the results. In another controversial article, despite the widespread use in Canada and Europe of textured, anatomic, highly cohesive gel-filled breast implants, there is a perceived gap in the literature regarding long-term outcomes for primary subglandular breast augmentation. In order to fill this gap, our next authors performed a retrospective chart review of over 400 consecutive patients and examined the demographics, the implant characteristics and complications, as well as preoperative procedures. Where does the Style 410 implant stack up with other implants? And what must be considered in determining the best option for your patients? The answers to these and many other questions are awaiting you inside this incredible issue, and that's PRS in 4 minutes or less. It may be time up for me, but it is time for you to start experiencing yet another exciting issue of learning in PRS.